Bone grafting and implant dentistry, building a foundation for success. Bone grafting is a common procedure in implant dentistry that plays a crucial role in creating a strong foundation for successful dental implants. In this video, we will explore the importance of bone grafting in implant dentistry and how it contributes to the long-term success of dental implant procedures. What is bone grafting? Bone grafting is a surgical procedure that involves placing bone tissue or material in an area where there is insufficient bone structure to support a dental implant. This additional bone material helps to stimulate new bone growth and provides the necessary support for the dental implant to integrate successfully with the surrounding bone tissue. Why is bone grafting necessary? Bone grafting is necessary in cases where the patient has experienced bone loss in the jaw due to factors such as tooth loss, gum disease, or trauma. Without an adequate amount of bone structure to support the dental implant, the implant may not be able to integrate properly with the surrounding bone tissue, leading to implant failure. Bone grafting is also essential for aesthetic reasons, as it helps to maintain the natural shape and volume of the jawbone, preventing the appearance of a sunken or aged look in the facial structure. Types of bone grafting materials. There are several types of bone grafting materials that can be used in implant dentistry, including autografts, bone tissue taken from the patient's own body, usually from the hip, jaw, or tibia. Allografts, bone tissue taken from a donor source, such as a cadaver. Xenografts, bone tissue taken from a non-human source, usually from a cow or pig. Synthetic bone graft materials, man-made materials that mimic the properties of natural bone tissue. The choice of bone grafting material depends on factors such as the extent of bone loss, the patient's overall health, and the preferences of the dentist. The bone grafting procedure. The bone grafting procedure involves several steps, beginning with an initial consultation and examination to determine the extent of bone loss and the best course of action. The dentist will then carefully prepare the site for the bone graft, either by making an incision in the gum tissue or using a minimally invasive technique. Once the site is prepared, the bone grafting material is placed in the area of bone loss and secured in place with sutures or screws. The patient is then given time to heal and allow the new bone tissue to integrate with the existing bone structure. After the bone graft is healed, the patient can undergo the dental implant placement procedure, where the implant is surgically placed in the jawbone. The bone graft provides the necessary support for the implant, allowing it to fuse with the surrounding bone tissue and create a stable foundation for the dental restoration. Benefits of bone grafting in implant dentistry. There are several benefits to incorporating bone grafting into implant dentistry procedures, including improved success rate. Bone grafting helps to create a strong foundation for dental implants, increasing the likelihood of successful integration with the surrounding bone tissue. Aesthetic benefits. Bone grafting helps to maintain the natural shape and volume of the jawbone, preventing the appearance of a sunken or aged look in the facial structure. Preservation of oral health. By restoring lost bone tissue, bone grafting helps to prevent further bone loss and maintain the overall health of the jawbone. Enhanced stability and function. Dental implants that are supported by a bone graft provide greater stability and functionality for eating, speaking, and smiling confidently. Conclusion. Bone grafting plays a crucial role in implant dentistry by creating a strong foundation for successful dental implant procedures. By incorporating bone grafting into implant treatment plans, dentists can improve the success rate of implants, preserve oral health, and provide patients with aesthetically pleasing and functional restorations. If you are considering dental implants and have experienced bone loss in the jaw, talk to your dentist about the benefits of bone grafting and how it can help you achieve long-term success with your dental implants. Remember, a solid foundation is key to a beautiful and healthy smile.